I'm going to get going. It sounds like everyone's joining the webinar. Thank you so much for joining me tonight for our information evening, specifically for same-sex couples that are trying to create a family. My name's Julia Paget. I'm the clinic director here at Complete Fertility. My background's in embryology. I've worked in New Zealand, America and London, and I've been in Southampton here since 2008. So let's get started. What we're going to talk to tonight is a number of topics, but firstly, I just want to say thank you so much for showing up this evening. I know it's a really big first step just to join an information event like this. Normally we'd have it in our clinic and we could get to know you personally, and we look forward to doing that at a later date. But obviously with what's happening in the world at the moment with the pandemic, we've moved everything online, but I just want to reach out to you and say thanks for coming along to this event this evening from your own homes. It means that you've already gone through so much together as a couple or by yourself, just working through what you need to do to create your family. And we really appreciate you reaching out to us and trusting us to get some information, because we know that it's not an easy step to make, and we're here to try and help you along that journey. Okay. We'll talk about who we are, who Complete Fertility is, and we'll also talk to you about the options available to you as a couple in a same-sex relationship. I'm going to let you know everything that we do at Complete Fertility to help create your family and what happens in a standard IVF or IUI cycle, but specifically with donor sperm, which of course you need. And then I'm going to help you navigate the next steps to treatment, because that's obviously frequently the most important thing that people come to these events for, is actually they just don't know how to take their first step and what do they need to do and how do you get referred into the system, etc. So we'll talk a lot about that. And now, of course, with what's happening in the world with COVID, we're going to talk to you clearly about what that means for your treatment. And we are up and running, and I will let you know the additional steps we're doing to make sure that you're completely safe through your treatment cycle. Now, through the whole webinar, you have the opportunity to talk and ask questions. So in the bottom of your screen, you should have a Q&A area, and you can type questions. And on the line with us, we've also got Julie Hedges, who's our donor coordinator, and she'll take over in the middle of the talk, and you'll meet her as well. She'll have a chat to you about specific issues around using donor sperm, etc. So please do ask questions, and she'll answer them along the way just by typing, and at the end, I'll be able to take some questions as well, okay? So who are we? Complete Fertility is a member of Virtus Health. So Virtus Health are the largest provider of IVF in Australia and in Ireland, and we've also got clinics in Denmark and Singapore. And what that means for us is that we're a massive interlinking group of centres that can reach out and share information. So our embryologists talk to each other, as do our doctors. We can share best practice around the world, and it's really fantastic to be part of such a specialised IVF group. Everybody that comes through our door wants a baby. We understand that wish. And what we're trying to help you achieve is a healthy single pregnancy. We know that multiple pregnancies is an extra risk for our patients and their babies, because often it leads to preterm birth and all the associated problems that that will come with. So our intention is to help you achieve a healthy single pregnancy. And because we work with close links to the University of Southampton, and our medical director, Ying Chong, is a professor in the University of Southampton, we have a lot of research programs going through our clinic. And that means that everything we do in our centre is evidence-based. So we don't just pluck things off the shelf because Daily Mail have written about them, or somebody searched something on Google. We want to know that if we're going to be offering something to help you get pregnant, that there's been clinical trials to show that that actually does increase your chance of pregnancy. So everything we do is evidence-based. We've got clinics in Portsmouth and Bournemouth, and with our larger clinic in Southampton. So that means wherever you live, we're kind of going to be more convenient for you, rather than having to travel distances, and only for the main treatments of IVF and insemination, which you need to come to the Southampton Centre. But otherwise, you can, the smaller clinics in Portsmouth and Bournemouth, we can do a lot of your appointments from as well. So this is just a slide to show that the HFEA, who's our licensing body, reported that between the years of 2016 and 2017, treatments increased by 32% for patients that have a female partner. And in 2017, 6% of all patients seeking fertility treatment were same-sex couples. Now, we know in our centre, probably about 30% of our patients are same-sex couples, so we've always just been very open to treating everybody, and we haven't necessarily seen a huge increase because we've always have a reputation for having a great donor sperm bank and being very fair in who we treat. So we're very welcoming as a group. This is a slide just to show you all of our friendly doctors. Everybody in this slide is a doctor except for me, and I'm in the middle there with Ying Chong, our medical director. If you go to any appointments in Bournemouth, then you'll be seen by Dr. Millie Saran there. And if you have any appointments in Portsmouth, you'll be seen by Dr. Dixit. And all of the other doctors are also based here in Southampton. So what can we offer you as a same-sex couple? So obviously we're going to need donor sperm, and what we have unique to our clinic is a very, very large donor sperm bank. We've got over 20 sperm donors, and Julie Hedges will talk you through how that works a bit. And when you're using donor sperm, your options are either to use it with insemination, or you can actually share that parenthood by having reciprocal, what we call reciprocal IVF, where one of you gives the eggs for the treatment and the other one carries the baby. So that means you're both really involved with the pregnancy, which is fantastic. But also you may, we're all women, and there might be something that's an underlying issue that we might not have discovered or you're very aware of. And from that, we can help you define what those problems might be and help you with any fertility issues you might have. So I'm going to hand over to Julie Hedges now. So I'm going to come offline, and then I'll come back in a bit.
Hi, hello everybody. My name's Julie Hedges. I'm the donor coordinator here at the Complete Fertility Centre. We have a donor team. As you can see from the picture, there's myself and my colleague Amy. We work together in an office. Well, normally we work in an office together. We also have a bigger donor team as well, with doctors and nurses. Now, as Julia said, we offer various treatments at the clinic for you. And with regard to donor sperm, we have our own donor bank. We have approximately, I think it's about 22 donors at the moment available for our patients. We recruit our own donors, and we have quite a stringent screening process and quite high criteria for our donors, so you can be assured that they're good quality donors. Can I have my next slide, please? Thank you. So this is just a little bit about the legal side. So the donor is not the legal parent, and basically remains anonymous until a donor conceived child reaches 18. So at the age of 18, donor conceived person does have the right to find out the identity of their donor, but until that time, the donor is anonymous. And as we said, it's not the legal parent. If your partner, if you have one, is seen as the second legal parent. Next slide, please. We have, as we've said on here, so who donates their sperm? So there are various reasons why donors will donate their sperm, and generally it's usually really good reasons. So it might be, for example, they know somebody who struggled to conceive. It just might be something they've always wanted to do, and they come from all walks of life. As you can see there, we've had teachers, solicitors, students, scientists, doctors, software experts. We've got a butcher, a milkman. We've got all sorts of from all walks of life, all different characteristics, different hair colours, eye colours. You would know this information about the donors. They also write a lot about themselves. They write a personal description, their reasons for donating, and a goodwill message. And you can see all of that information before you decide on a donor. Now, in this country, donors can help create up to 10 families, so we can't go over that 10 family rule. So once 10 people have reserved a donor, that donor would not then be available. And as I've mentioned, at the age of 18, a child may ask for the information to contact the donor. We have a donor sperm website, which is where you can view the donors. Do we have that slide, please? We have, yeah. So this is just a screenshot of what you can see on our website. So what happens once you've had your implication counselling? So anybody that's donating or using a donor will have a session of implication counselling. Once you've had that, you can have access to this website, and you can view. This is the first screen you'd see. As I say, it gives you the basic information on this screen about eye colour, hair colour, height, occupation. And you then click on view profile and you can read some more information, so what they've written about themselves, before you make a decision. Majority of people do choose one of our donors. However, in the unlikely event we didn't have a donor that suited you, we do accept imported sperm from 3 other clinics. If that's the case, we can give you that information. How do you select a donor? Well, as I've said, there's lots of information that you can have there. Some people have an idea in their mind of what donor they want, maybe blue eyes, blonde hair, but sometimes I find once you read what the donors have written about themselves, people quite often change their mind, and that becomes more important than the characteristics. But obviously the most important thing is that you have the right donor for you. We do offer mutual or reciprocal IVF, so we do offer same-sex couples the chance to be able to donate one to the other. So we do a partner-to-partner donation, which means one partner donates their eggs to the other partner. It means you're both involved in the baby, which is really nice. And we also offer, you can share as well. So we do egg sharing, which means you can do partner-to-partner egg sharing if you wanted. So you can donate to your partner and an anonymous recipient. A lot of same-sex couples like to do that because they need donor sperm to help them. They would like to help somebody else, which is a really, really lovely thing to do. And obviously you're both seen as legal parents as well. Next slide, please. I'm not sure what's on the next slide. There we go. So next slide is about egg sharing. So egg sharing is what it says really. You share your eggs. So you keep half your eggs for your own treatment, and you donate half your eggs to an anonymous recipient. So somebody who can't use their own eggs in treatment and relies on a donor to be able to have a pregnancy. So it is a lovely thing to do. We can't pay somebody to donate their eggs, but we can give what we call benefits in kind. So egg sharers would receive either IVF at no cost or at a very small cost, depending on what package you go for. Egg sharing, where you would just donate to use the eggs yourself and donate to a recipient. There is no charge for the IVF. If you do the partner-to-partner egg sharing, where you donate to your partner and a recipient, it's £500. So as you can, but it's greatly reduced, obviously, and it is a really, really lovely thing to do. And our recipients are just so grateful to people that do this. Yeah, is there anything? Is the next slide?
Thanks, Julie.
I'll take
over from that. Yeah, thank you. So Julie's on hand to answer your questions, and I can see some questions are coming in. So she'll type away in the background while you're asking questions. That's great. So I'm going to talk you through what happens on a fertility treatment journey. So anyone that lives in the Hampshire area can get a referral from your GP for that first appointment. If you're outside of Hampshire, it depends on your clinical commissioning group as to whether the same-sex couple can get that initial referral. But in general, for that first appointment, it's worth asking your GP to see if they'll refer you in for an NHS appointment. Otherwise, you can come straight away in for a private appointment, and you can just self-refer. You don't have to tell your GP unless you want to. So you come in and you have your first appointment either on the NHS or privately, and you'll see one of our consultants in the centre. But at the moment, we're actually just doing all of those appointments remotely, which is working really well, and it's nice and convenient from your own home and very flexible on the timings for you as well. And at that appointment, we'll look at any of the tests that GPs have already done, any sort of background information you've already had, and then we can work out whether you need any further tests. We usually do a further test, a hormone level called an AMH test, to see how your ovarian function is going. And we might have a look at your tubes as well. I refer you for what we call a Hycosi assessment, which is looking at your tubes to see if the sperm can swim up the tubes absolutely fine. And then from that point, you can either be referred straight on to having treatment, or it might be just in a few cases that you might actually need a little bit of an intervention or some kind of surgery. Perhaps you've got a fibroid or something going on with your tubes that might need a further surgical optimization. And the great thing about our clinic is that because we're based in the NHS hospital, our doctors will work in that hospital and can do those surgeries for you and then bring you straight back. And so you're not lost on a pathway of going to various clinics. And then once you're ready you've had all your investigations and potentially any surgery, then you're ready for fertility treatment. And that's when Julie Hedges gets involved and helps you to choose a sperm donor. So I'm going to talk you through what happens in a standard treatment cycle, whether you're going to have the sperm inseminated, which is what we call IUI or intrauterine insemination. There it says DI, that also means donor insemination, exactly the same thing. Or you're going to have IVF, which is when we take the eggs out of your body and put the sperm with them in the lab. For both sets of treatment, it's exactly the same until we get to the day where you start to ovulate. So to begin with, you call us on day 1 of your period, and we bring you in a couple of days later to start having what we call a baseline scan, to have a good check of everything that's going on and check that it's all ready to take on some stimulation medication. But in this new situation with COVID, we're actually a couple of days before that, we would do a COVID test for you to make sure, give you the security and our clinic the security that you're completely clear of COVID infection. And we'll then monitor you every time you come into the clinic to check that you're healthy and well. So you start taking medication a couple of days after your period. Once you've had that baseline scan to check that everything's okay, you'll start injecting yourself with some medication that starts to stimulate the ovaries and the follicles to produce eggs in your ovaries in a very controlled way. And then a few days after that, we introduce another injection. So you start taking 2 injections. And the second injection is what we call an antagonist, and that stops your ovaries from ovulating so that we can control your cycle. Now, for an IUI or an insemination cycle, we only want 1 or 2 eggs to be produced. So it's a very low level of medication that we'll give you. But for an IVF cycle or ICSI cycle, we want ideally between 8 to 10 eggs, but it might be up to 20 eggs. It might be just 1 or 2 eggs, but we're aiming for about 10 eggs. So we give you a slightly higher dose of medication to stimulate your ovaries a little bit harder. And then once you start taking those medications, after a few days, we bring you back again and we start what we call your tracking scans, where the nurses look at the ovaries to see how your follicles are developing and how the eggs are developing inside those follicles. And once we've got a couple of follicles about 17 millimeters in diameter, we give you what we call a trigger injection. And it's quite specifically timed, that injection. We'll tell you to take it usually about 11 p.m. at night or midnight, because 36 hours later, we're going to want to do our egg collection for IVF, or if it's an insemination, it'll be about 38 hours later. Don't worry too much about those timings if you're running late that day or you can't park, because we've got a very good window around that timing. But these are the timings we give you to try and organize how you come into the center and when your eggs are going to be most ready for insemination. So once you've had that injection, the trigger injection, a couple of days later, we'll get you in for either your insemination, if you're just having the donor sperm back into the uterus, which is when we just put a simple catheter, little thin, like a piece of spaghetti, through your cervix, through the neck of the womb, and release the sperm into your uterus. Okay, so it's nicely timed, putting the sperm in the right place for the exact time for when that egg is going to be released from your ovary. If you're going to have IVF, because we know that we need to get the eggs out from you, it might be because you've already had some insemination cycles before that weren't successful, or you're sharing the parenting with your partner, or you just know that this is the right treatment for you because you've worked that out with your doctor appointments. Then we will do an IVF cycle where we take the eggs from your body and we use a consultant anaesthetist for that, so you don't know anything about it, and we take the eggs out and we inseminate them in the lab. And I'm going to talk to you more about that in a second when I talk about the IVF process. But once you've got your embryos from the lab, we can then transfer them. Again, I'll talk to you in detail about this. But then once the embryos have been transferred or you've had your insemination with your sperm, then comes actually what we find is the most difficult part of your treatment, which is when nothing is happening. It's called the 2-week wait that I'm sure you've heard about from maybe other friends that have gone through this. For many people that go through this process of fertility treatment, when you have those embryos put back into you or the sperm put back into you, you're then left for 2 weeks to wait to see if you become pregnant. And of course, after all this time of spending time with our nurses looking after you very, very frequently, sometimes patients can feel really quite bereft at this point. So what we do at Complete Fertility is check in on you during this time and encourage you to call us if you're at all worried until you have that pregnancy test a couple of weeks later. We really hope it's positive, and if it is, then we'll go on and give you an early pregnancy scan at what would be 7 weeks gestation, which is really about 5 weeks from when your treatment happened. But if it's not positive, then of course we offer you counselling and we follow up with you with our doctors and nurses and check what you want to do for the next steps. So this is just a picture to show our lovely nursing team and our healthcare assistants. So the nurses are very much involved with your treatment during the process. Once you've seen the doctor, meet with one of these lovely nurses, and they'll go through all of your consents with you. They'll teach you how to take injections, and they'll really become your link person for your treatment through the centre. So you'll get to know them really well. Obviously, sometimes they're on holiday, or some of them might work part-time, so you might meet a couple of them. But we really want to hear from you. If you think you're not getting on well with your nurse and you prefer to try another one, just let us know, because of course we're all different personalities and we want to find someone that connects with you really well. So please just let us know. We'll never ask you why. If you want to see a different nurse, just request that. Our healthcare assistants at the bottom there are the wonderful people that look after you when you come in to either have a tubal assessment or an egg collection or an insemination. They really are fantastic. And I think what's really key about Complete Fertility is obviously the people that we hire have to have the right experience and skills and education, but we really place huge importance on our recruitment, that are these people nice that look after you. And we do think we've got one thing in common for all of our staff, is that they're really nice people and they really care and they want to help you get pregnant. And in the lab, it's the same thing. Fantastic bunch of people. They're the ones that look after your eggs, the embryos and the sperm while they're outside of your body. So what I'm going to do now is talk through what happens in the IVF lab. Okay, so these are pictures from our own clinic here. This is Claire, one of our embryologists. The whole time the eggs and embryos are outside of your body, we're trying to kid them that they're still in your body. So we make sure that everything that they're in is based around the environment that's in your uterus, tubal, your reproductive tract. So that's what the fluid that we put in is based around. And also the temperatures and the pH are all based around that sort of body temperatures. Okay, so we use these incubators, you can see on the right there. They look like sandwich toasters and they're called mini incubators, and they basically keep everything safe and warm while they're outside of your body. What we have in our clinic is a fantastic incubator called an embryoscope, and that actually takes time-lapse images. You can see on the right there the video showing what's happening with your embryos, and these photos are taken every 10 minutes during culture, and that allows our team at the end of 5 days of culture for us to choose which are the best embryos to go back and the ones most likely to achieve a pregnancy. And the reason we can do that is because all of the things that happen during those divisions that you can see on the right there, sometimes there's some anomalies or things that aren't quite right, but you wouldn't actually see those if you were just checking the embryo once a day. So it's really fantastic to have a video of the embryos. So once the eggs are taken out of your body, we prepare the sperm, and obviously in your case we're going to be using donor sperm, which has been frozen, it's been quarantined while that donor has had all of his health checks, etc. So it's been waiting for 6 months to have an all clear on the health of that donor before it's used. And on the day of the egg collection, we'll take out some of the sperm and we'll thaw it down, and then we prepare it. So we spin it down, and we can either decide to put about 100,000 sperm with each egg, which is called routine IVF, and you can see that on the left. And in those instances, the sperm just compete to get into the egg, and the first one in there wins. And then once one's in, then no others can come in, because it's an incredible process that the egg has to go through. That I think one thing of working in this field, you're amazed that anyone can get pregnant naturally. It's just such a complicated process of fertilization. But key there is if one sperm gets in, the others can't get in, which is quite important. Or what we often do with frozen sperm is we do what we call ICSI, intracytoplasmic sperm injection, which is where we take an individual sperm and inject it into the egg. And that's because in frozen sperm, it can knock off some of the viable sperm, and we want to make sure that we get fertilization. And you might say, well, why don't we do ICSI on everybody? Because just putting the sperm in there, you think that would guarantee fertilization. But in reality, whether we do ICSI or IVF, about 70 to 80% of eggs fertilize the next day. Because even with ICSI, where you put the sperm into the egg then has to go through a really complicated process. So it's not guaranteed at all that you get fertilization from ICSI, but of course it does guarantee that the sperm gets to the right place, which is really helpful. So this is a video of ICSI, and what I can show you first is that we've taken the cells off around the egg, first of all, that have been supporting the egg for growth within the ovary. So that means that we can hold the egg with this thing called a holding pipette here, and we've got a sperm here in the needle that's been sucked up tail first, so it's ready to come out head first into the egg. And we've positioned the egg with this little bubble on the top, which is called the polar body, and that's got half the genetic information in to hold it away so that when the egg combines with the sperm, it can create a new set of chromosomes that have the correct number of genetic information in them without being doubled. So what's going to happen now is you'll see that the sperm here with my pointer is going to come down the needle very slowly, because we don't want to lose it. And then we're going to push the needle through the eggshell here. This is the eggshell called the zona pellucida, into the egg. And now we've actually got to break this membrane. So we suck back the sperm. The sperm is right here where my pointer is. And we keep sucking until the egg goes pop, basically, because that membrane's got to pop for us to know the sperm is in. And there, it's popped now. It's rushed up there. The sperm is right up here now. And now we're going to put the sperm back down into the egg. There's the sperm into the egg, and get the needle out of there quickly. And hopefully that membrane then seals up there and allowing the sperm to do what it needs to do. So the next day after an egg collection, and we've either done IVF or ICSI, we're now looking for 2 sets of genetic information. So you can see here, one of these is a male and one of these is a female set of genetic information, one from the sperm and one from the egg. We don't know which one's which. And this embryo could be male or female. It all depends on which sperm is put in, whether that was a male sperm or a female sperm, which we cannot tell down the microscope. So as I said before, about 70% of your eggs should look like this. Sometimes, really unfortunately, no egg fertilizes, and that would be called a failed fertilization, which is a really, really sad event, which we try to avoid at all costs. But it can happen. And other times you might get 100% of your eggs looking like this, which is fantastic. And then they start dividing every day from about 2 cells, 4 cells on day 2 after egg collection to day 3, what we call a cleavage stage embryo. It's about 8 cells here. But up till this point, the egg has been in charge of all of these developments. And beyond day 3, the embryo, the future embryo or baby, in theory, takes over the divisions of the embryo. And so if we can go beyond day 3 in the lab, then we can start to get embryos like this, which we call a blastocyst. And these embryos have got a much greater chance of implantation and causing pregnancy than embryos at this stage, because they're showing us, they're demonstrating that they're viable and that they have potential to become a baby. So for every 10 embryos that look like this at the cleavage stage, we'll only get about 3 that look like this at the blastocyst stage. And what we can see at the blastocyst is this part here at about 9 o'clock is what we call the inner cell mass that's going to become the baby. And then around the outside is the trophectoderm, which is going to be the placenta. And you can see also here this fuzzy bit, and that's the eggshell called the zona pellucida, and it's got to hatch out of that, which you can see here, it's hatching out to cause a pregnancy. So just like chickens, we've all had to hatch out of an egg at some point, which is quite amazing. So this video has come from our embryoscope, and you can see here all of those stages happening through time lapse. So you can see the 2 sets of genetic information here and here, and this is day 1 after egg collection. Then they disappear and it becomes a 2-cell embryo. You can see the nuclei of the cells as they divide. It becomes a 4-cell embryo, and at this point the egg is still in charge of all these divisions, okay, not the embryo yet. And now it's becoming an 8-cell, and around about now the embryonic genome switches on, which means the embryo is starting to become in control, and you'll see it becomes what we call a morula, and it compacts down, looks a bit like a beach ball, and then it gets a little bit of fluid in the middle called the blastocele, which is a cavity, and it starts pushing that fluid out. This part is the inner cell mass that's going to become the baby right here, there, and around the outside is the placenta, and what will become the placenta. And here you can just see it went pop, and that's where it's starting to hatch, and it literally just squeezes through that eggshell to get out. It's quite miraculous how it does it. So what we have in our clinic is an electronic witnessing system to reassure you that at every stage we keep your eggs with your eggs, and that there's no transference to any other patient, and the donor that you selected is your donor and yours alone. And when we bring it into this area, this white stage here, it's being read by barcode readers on this screen here. And so if you are Mrs. Jones and we put you with donor number 1, and Mrs. Smith comes into contact with donor number 1, all hell basically breaks loose on this alarm system. So we would know very quickly that these are incorrect samples. So it really, really reduces risk, okay? unique to Complete Fertility, and something that we really pride ourselves on, is how we look after you. So we know that not everyone's the same. Not everybody wants to see a counsellor. Not everybody wants to go to a support group. So what we've done is not a one-size-fits-all approach. We've got lots of different areas of support for you to choose what works for you. So firstly, we have a counsellor. Our counsellor is called Judy Noakes, and we also have an external counsellor called Ruth Wild that you might also see sometimes. And you can access our counsellor up to 6 times. If you want more than 6 times, we'd also be fine with that. So, but basically our mantra is that you should never have to pay for counselling. We want to positively encourage you to use a counsellor. Now, if you're going to be using donor sperm or any donor gametes, or donating yourself of eggs, for example, it would be obligatory to see a counsellor. But either way, we would still positively encourage access to a counsellor. Okay. We have an app that's unique to our centre that is not just about controlling, helping your treatment cycle with medication, etc. It also has an emotional aspect to it, and it gives you coping mechanisms and mood management information. So it's another tool you don't have to discuss with anybody else. It's just there in your pocket on your phone, and you can access the information on that app. And over time, we're working on a research project that's actually asking you your levels of anxiety during that 2-week wait after your embryo transfer or insemination, waiting for your pregnancy test. And it's asking you, how are you feeling? And if you rate a really high level of anxiety, it's going to be able to trigger a phone call from our nurses to check in with you and check you're doing okay. So we're actively working towards that. We've always had a support group in our clinic, but obviously during COVID, that's not appropriate to be doing. So we've moved our support group online. So that means if you just look on Facebook for the Complete Fertility Patient Support Group, you can join that group. It's a closed group, and it's moderated by one of our senior nurses, Debs McGuire, and a counsellor, Ruth Wild. So it's a lovely place to just explore your emotions, see what other people are going through, and connect, and people, the counsellor and the nurse will be posting sort of information on their support for you. We've got a buddy program here, which means that, you know, if you don't want to share with lots of people or talk to a counsellor, you might want to meet somebody else that's going through exactly what you're doing. So if you contact us and say, I'd be interested in being matched with a buddy, we find somebody else in a similar situation to you. They might be going through a similar treatment cycle to you or same background as you. And then we ask them if they're okay to give your information to them, and vice versa. And then we let you just take that how you want to. You can set up a WhatsApp group with that person. You can phone them, go for coffee post-COVID, or maybe make a friendship for life, or maybe just find somebody that you want to hang out with during your treatment, and then no further. It's up to you what you do with that, but it's a really popular program. This slide just shows how well we do for insemination when we use donor sperm and put it back in the uterus, called donor insemination, DI. Our results are 14% above the national average. So you can see on the right there, our results were 20% compared with the national rate of 8%. I haven't got my glasses on, I think that says 8%. And that's births per treatment. That was for 38 years old and over, and on the left it's 38 years old and under, and that's 31% success rate in comparison to the national average of 17%. So we really do specialise in this, and we know how to get you pregnant, which is great. So this is just some add-on information to reassure you of everything we're doing since the COVID pandemic has hit us. Of course, it's taken us all by storm. And for a couple of months, our clinic was closed for treatment, although we kept on going for all of our remote appointments and support groups and counselling, etc. But now the HFEA have granted us a licence to reopen, and we have a multitude of new protocols and safety measures. So I'm just going to talk you through the highlights of that. So all consultations will now be via Zoom or over the phone, so you don't have to come into the clinic. We're reducing the footfall of our patients and staff, so any staff that can work from home are working from home. I've been at home all through this period. I've only come into the clinic today just so that my technology doesn't give out during the webinar. We've split our staff into teams, so there's less crossover of staff within the clinic. We have contact sheets of who our staff are coming into contact with. For patients, we're keeping you out of the clinic as much as is possible. We only need you to come in if you need a physical test or a physical process. Apart from that, it will all be done remotely or over the phone. We've got PPE in supply for at least, you know, for every case we need, and we've stocked that up for at least 2 months supply, and we'll continue to do so, that we're very not worried that we'll be running out of PPE at any point. And we will be supplying our patients with that PPE when appropriate, and for our staff as well. And for any patient that's having treatment with us, or a contact test like a tubal assessment, you will be given a COVID test, a live COVID test, a swab, 48 hours before any procedure, so that we know that you're safe. And then from that point, you'll be asked health questions routinely before any appointment here. We're not using our waiting room anymore, so all appointments will literally be coming from your car or outside, and we'll call you straight into the room. You won't be waiting within the clinic. We've got a new social distancing policy. You'll see screens and markers all around our clinic, and we've spaced out all of our patients so you don't come into contact with any other patients anymore. There's much more time between patients to allow for all the PPE, the cleaning, and all the social distancing. And to accommodate all of that, we've put in much more extended opening hours to allow for that. This is just a photo to show that all through our clinic now we've got all of these social distancing signs, and we've got a big screen going up in our reception this evening actually, but we shouldn't be using our reception now anyway. We shouldn't need to be doing that. This just lets us know, lets you know what the HVA say about us. We have a very good relationship with our regulating body, the HVA. They provide nice feedback for us, and it's all on our website that you can see all this information, or you can look on the HFEA and look for our latest reports there. So in summary, why would you choose Complete Fertility for your care? Well, we're really passionate about looking after you. We've got counselling groups, buddy programs, the app, the support app, and our online support groups. We're really friendly, and we're really experienced, and we are dedicated to looking after you. We've got local clinics in Southampton, Bournemouth, and Portsmouth, which hopefully provides some convenience. We've got an in-house egg, sperm, and embryo donor program, which is quite unusual for most clinics, especially how large our sperm donor program is. With egg sharing, you can access free IVF, which is a really fantastic thing to do with appropriate counselling. We have a private room available if you request it. We've got the embryoscope time-lapse incubator available. And what's key for us as well is that we try really clearly to not have any hidden costs. It can be really confusing to look at price lists from fertility clinics. We've tried to make that really, really simple. You can look at our price lists on the website. We can post them to you. Everything is in really clear boxes. It tells you what's included, what's not included. We've tried to bundle everything up into packages. And before any treatment cycle, you have what we call a costed treatment plan, where you'll go through all the details with your nurse and sign to show that you really understand all of the prices involved. If the paying is a concern for you, which of course it is for many, we have an interest-free payment plan, so you can spread the cost over 12 months for no additional cost. And we've got the active research program for all of our evidence-based treatments. So because you can't be with us tonight, I've just put some photos online here so you can have a look around our centre. So this is one of our waiting rooms. We've got 2 waiting rooms. We were fully refurbished a couple of years ago, so it's very fresh and light. This is a couple of our corridors with some of our staff. This is Claire in the lab. We've already seen these pictures of her doing some IVF. Claire again was here the day of the photographer. She's on the left, she's got some frozen sperm there, and on the right she's doing an ICSI. And this is a couple of our consulting rooms, not very professionally taken. I just took these on my phone today. And this is our recovery room, where you would go for your IVF treatment. And this, when you have your egg collection or embryo transfer or insemination, you would use this room. It's kind of like a theatre, but not as intense or frightening as a theatre. You've got a screen up here on the right that's connected to our microscope next door, so you can see any embryos that are being put back into you. You also get a photo of your embryos. And if you use the embryoscope, we'll give you a video of your embryos as well if you get pregnant. We always have an offer when we do an information evening. So tonight, for all of you, if you're interested in booking an appointment, then we would offer you £100 off donor sperm. So just drop a line on the question tab if that is of interest to you, or give us a call or an email tomorrow from info@completefertility.co.uk and let us know that you attended the webinar and that you'd like to make use of that offer. It's usually £850, so it would be £750 with this offer. And this is just some feedback from some of our patients that, again, is all on the website. Now, I am going to try and find the questions, and I can answer you some. So let's have a look. It looks like Julie Hedges has been very busy in the background answering questions, and she's handwritten answers to all of you. But I'll read some out. Okay, so first question is reciprocal IVF, so mutual parenting. Can that be funded through the NHS? I'm afraid that the NHS do not fund treatment in same-sex couples unless there's some criteria. So if you have demonstrated that you are infertile, then you may have NHS funded treatment. And to do that, you'd need to have at least 6 cycles of insemination or attempts at pregnancy. So often that is obviously very financially trying for many couples to go through that to get NHS funded treatment. So it's very unusual, unfortunately, that same-sex couples can be funded for NHS treatment of any means. Okay, they might, outside of Hampshire, it might be the case, but within Hampshire, that's not the case. Obviously, we all live in different places, and clinical commissioning groups, as you may have heard, give what we know as the postcode lottery. So it really does come down to where you live, and if you let us know where you live, then we can look at specific information for you if you're outside of Hampshire. So the next question is, do you need to do IUI before you have IVF? No, you don't at all. And many couples or single ladies even opt straight to go to IVF because it really depends. You'll work that out with your appointment with your doctor. Some people really want to have IUI first of all because it's they don't want to go too medicalized too quickly. And dependent on your medical history, you might be a really good candidate for IUI. For example, if you've not had regular intercourse before, not been exposed to sperm, and your hormone profiles are good and you're fairly young, etc., then the doctor might recommend that you just have IUI insemination because your chances of getting pregnant should be quite high. If you think those chances are not so high, then opting for IVF where your chances can be higher can often be recommended. So it would be something that we talk through with your doctor, but absolutely not. You can have IVF straight away without doing insemination first. The next question is, if my partner was to donate eggs, could I also use the eggs as well as donating whilst getting free IVF? Absolutely. So that's called egg sharing and partner-to-partner donation. I think it's not completely free, and Julie Hedges will give you the details of that, but it's much discounted for doing that. It's not completely free because it's complicated in terms of matching, but that's definitely something to explore, and we would love you to consider that. Obviously, egg sharing is a big thing to consider, and we don't want anyone to feel pressured into doing that, but we would be happy to explore that with you. So a few more questions. I have PCOS and I don't have periods. Will they then tell my partner to carry the baby instead? I would like to carry her egg. Again, that's something that needs to be talked through at a medical consultation. I'm not a doctor, so I wouldn't want to comment too much on it. But we'll work all that through with you. And what we do is a couples fertility check that we can arrange for you, where both of you come to an appointment with a doctor, and you both have an assessment for each of your hormone profiles, and you each have a scan, and so from that can work out who's the most beneficial for you in the partnership to carry the baby. But of course, personal preferences obviously come into this as well, so we'll listen to you carefully on that. Next question. How many times are we likely to need to travel to the clinic around insemination? I don't want my employer to know until I'm pregnant, and we live 50 miles away. You live a long way away, so it's great that you're talking to us, and it's lovely. So it's great since there's, you know, there have been some benefits, which is, it's awful to say around COVID because it's been such an awful time for so many people. But one of the benefits for us is that we've realized that actually remote consultations work so well. So all those initial consultations we can do remotely. However, things like blood tests and potentially tubal assessments obviously are going to have to happen here. It's a really difficult one, not telling an employer or telling a support person. We would try and recommend, if there's somebody in your place of work that you can confide in, it will be so much easier for you. But we understand why some people just can't do this. It will be tricky because we can't give you timescales, say a week in advance of, we'll know that you need to come in Monday, Wednesday, Friday next week. It really depends on how your body responds to medication as to when we need you to come in. So we'd work that through with you basically, and our nurses would spend time mapping it out for you. But having somebody in your employment that does know really makes it so much easier for you. So, okay, that's a tricky one. Talk to us about it, I would say. It's really difficult. Next question. Is the medical consultation separate from the initial consultation, which we have already had with a consultant? So you've already had an initial consultation with a consultant, which is a great start. And then if they recommend treatment, you usually have to have what we call a treatment planning consultation to begin your treatment. So you would need to see the doctor again, and at that appointment they will specify exactly how much medication you're going to have, what consent forms you're going to do, and what your next steps are. Sometimes that's not necessary, but most of the time it is. Okay. What is the success rate of IVF ICSI? Okay, so that's a big question, and I would recommend you go to our website and look at the success rates for your particular age group, because of course everybody's different, and we split up our success rates according to your age. Usually when you use donor sperm, your success rates tend to be a little bit higher because in theory there may be no underlying issues with you. If there are underlying issues with you, then things change. On average, for somebody, say if they're 35 years old, I'd say it's around 40%, but it really does come down to where you fall, what your age is, what your history is, etc. And it's really hard to focus on the numbers when it's always so individual. But we'd happily talk that through with you over the phone. It might be easier. We have been referred to a clinic in Surrey. Does this mean it will be our clinic throughout, or will we end up being referred to you when the process starts? So that's an interesting question. That's entirely your decision. We don't have an association with that clinic. But if you wish to, it sounds like maybe you've been referred there by your GP, and if they then refer you for IVF, you can select us as your IVF clinic. Or just pick up the phone to us and we'll help you do that. I think what's key to get across as well is often some people get stuck in the process around GPs and secondary care, which is when they're having tubal tests and blood tests in hospitals, and they find it really hard to get the next step. What we offer at Complete Fertility is we do that secondary care as well. We can do all that initial tests from your GP. So your GP can refer directly to us for those first tests. If you're already in another system somewhere else, that's absolutely fine. But if you're getting stuck and feeling you can't proceed to referring to us, please give us a call and we'll help you through that process. We can call your GP or we can help get your test results, etc. And we'll help look after you through that. Can we choose to have a gender diagnosis? No, I'm afraid that's not something we're able to do unless it's for a history of a medical disease in your family that is linked to either one sex, either male or female. And in those instances, it may be possible to look at the gender of an embryo for that reason. But in the UK, that is not something we can do. We can't select gender for treatments. We would like to book our appointments. We have a counselling booked. Can we book anything else yet? Yes, you can. It may have been, we may have stalled you through COVID because of not being able to progress with treatment. But I would say get back in touch with us and we'll happily arrange those appointments for you. Now, let's see, is there an upper age for egg donation? Yes, there is. You need to be under 35 years old. In partner-to-partner egg donation, we're more flexible with that, so we talk that through with you, but we recommend up to 35 for egg donation. And next question. what is the test to know how fertile you are or how many eggs you have remaining? It's kind of a combination of tests, but the main blood test we use is AMH, anti-Müllerian hormone. That's something you can't necessarily get from your GP, but you can get from us. And we combine that with your medical history and your age, and also a scan that shows how many follicles are developing in your ovary, and then we can get a picture. So that's all the questions I can see, and I think Julie, if Julie wants to put her video on again to say goodbye or say anything else, then I encourage her to. But thanks so much for your time. If you've got any further questions, please do email us info@completefertility.co.uk or give us a ring 02380 010 570. Hi Julie, have you got anything else you want to add?
No, I'm just having a lot of queries come through, so keep them coming. If I don't get to them tonight, I will get back to you. But seems to be a lot of interest in things like egg sharing and reciprocal IVF. So please feel free to answer any questions, and I'll do my best to answer them.
Yeah, and I'll say, if you're a single lady out there and not in a relationship, we've got another webinar on the 2nd of June, and I strongly recommend you join that as well, because it's specific for single women undergoing fertility treatment. And we will continue these webinars sort of every couple of months if you want to join any others or recommend to a friend, and we'll put it also on our website in the video section, so you'll be able to listen to it again if you want to have a think. So I did have yeah, go on.
Sorry, I did have a question asked by a lady to say the discount you receive for egg sharing, is that dependent on the recipient having a positive pregnancy test? No, that's not the case. We would never ask you to do that, because we can never guarantee that. You do a lovely thing by donating, so the outcome of the recipient cycle has no indication on whether you receive your egg share discount or not.
Absolutely, yeah. Thanks, Julie. Well, thanks so much for your time, Julie. Thanks, Aoife, for helping us host the webinar, and thank you to everybody. I'm going to sign off now. So good night and thank you. Bye-bye.